Welcome to another ICA Sports and Fitness Science Council podcast. And I'm Dr. Brant Hulsebus, and I'm joined today by a fellow board member, Dr. Kevin Jackson. And today we talked a little bit about different things that we bring to the table as board members in our actual practices and what we do in chiropractic. And I got to know Dr. Jackson quite a bit. I've heard a lot about his subconcussion work that he's doing literally at the games. And Dr. Jackson, you want to take 2 minutes real quick and help some of our chiropractors watching this that maybe don't understand concussion, subconcussion real quick?
So a concussion is an event where, there's going to be trauma to the brain and frequent, but not quite as frequent as what we call a subconcussive hit. So, and subconcussive hits, when they add up, make brain changes as well. Like, for example, if you high school football players are now starting to show signs of changes in their white matter of their brain just from playing the game, not necessarily having concussions, but having repetitive impacts to the head and to the brainstem and to the upper cervical spine. So they accelerate either from a body check, some type of helmet to helmet collision, some type of impact with the ground. But it's very significant, but it does need some education that needs to go to the coach, to the mom and dads, and to the trainers, just to differentiate what it is that you're looking for.
Now, I always say that you can't have a head injury without a neck injury. It's
It's
impossible.
it's absolutely impossible. And that being said, there's two types of concussions. There's one where you take an impact, the head accelerates and the brain wobbles, and it takes about 80 G's of force to make the brain bounce, to and from in the skull. And then you have another one where the head accelerates and it puts a lot of shearing force out in the upper cervical area, the cranial cervical junction, and that's where the brainstem is, and that takes about 5 G's of force. So, we have to be aware of the two different types of concussions, and then you also have to throw in the subconcussive impacts that also affect the neurology of the player.
Now, as a chiropractor, and you've worked with sports teams, whether it's a professional team or whether it's just a youth t-ball league team.
Yeah.
What are some of the ways you communicate with the trainer or the parents or the coach when you suspect you might see something?
Well, I'd like to lay down some groundwork before it ever occurs in that what chiropractic is and what it isn't. And to me, the biggest differentiation is chiropractic is definitely not massage therapy, and it's definitely not physical therapy. They're very, very valuable on their own. But me as a chiropractor, I'm looking for taking a look at the biomechanics of the cervical spine, and I'm looking at the neurology that comes out of the cervical spine, the brainstem, and the nerve roots that are attached that go into the arm, among other things. I mean, that's what I like to focus on, is that upper cervical spine when I'm out on the sports field. But that being said, the parents know that anytime there's any type of impact where the head accelerates either directly from helmet to helmet contact or helmet to the wrestling mat, or if there's a body-to-body type of contact or collision, there could be some issues with the upper neck there. And it's a really simple process that we run through. And essentially what it is, if we're in a sideline and we think someone gets hurt, we just run through real quick the 3 planes of range of motion. We go into extension and flexion, lateral bending, and then we go through rotation. If there's any biomechanical deficits, we're going to take a look at adjusting that area. Another way that we are going to assess the nervous system is we're going to use like a handheld thermographer, and we're just going to check the atlas fossa area from the left to the right. And if it exceeds a 0.5 degrees Fahrenheit threshold, we're going to say there's some type of neurological interference. B.J. Palmer, who knew a little bit about chiropractic, said that heat and nerve dysfunction go hand in hand. And so we're going to use that. And if it looks like there's been some type of brain injury, we'll get the pen light out. We might look at the pupils and that. And also we can also use Romberg's test real quickly. So the deal is this, is if someone's in the heat of the moment in the game, you're not going to be able to put them down on a chiropractic table and do a full chiropractic technique. In most instances, you're probably just going to have a split second to go through some range of motion, do an adjustment real quick. Now, when I'm in that setting, what I'm going to use to make an adjustment is going to be an activator. It's just really quick, pull it out of my pocket and then get in at any different angle that I need to get in. The technique's a whole different discussion that we can have at a future date. But there's no reason why a chiropractor can't be on every sports sideline and checking for subconcussive impacts. It'd be totally a game changer for the athlete, I think.
I work with a lot of athletic trainers, and they all have their hip bags and their shoulder slings of all their equipment. You might be the first chiropractor I've met that has your own chiropractic sideline bag in order to do assessments, which is awesome because
Yeah,
you're not guessing. You're trying to use as much scientific data as you can on the sideline in the
yeah.
situation you're at, and that's chiropractic right there, specific.
Parents and the players and everybody understands range of motion. So if you put them through a simple range of motion test and you see a deficit, or they more so if they feel a deficit, it's one of the best indicators that you can have. And then if you can match it up with a heat reading from left to right, which is just inflammation, everybody understands that. So the optics are real good. And then if you're not taking a player who just been traumatized and you're going to do a double rotary break on them without any clinical findings like pre and post test, that doesn't have good optics in my opinion. But if you take something really gentle like an activator and you just gently adjust, and then you can demonstrate to the everybody watching, and especially the player, that their range of motion has improved and that their thermography has evened out. It's just a win-win situation, and it's just a really, really good look for chiropractic. And I one day my goal is to standardize that approach where it's just universal, that we have a universal protocol, which I have, and everybody, it doesn't matter what size the chiropractor is. It could be like a 90-pound woman taking care of a 300-pound lineman when it comes to this type of care.
Then obviously, the next day you're going to go into your office. Then you're in your office. Every tool in your clinic is now free game to use. This is not
Exactly.
the end of the assessment. This is the beginning of the assessment.
That's right. That's right. So we'd follow up if need be. If they were an established patient, then we could do X-rays. We could do our orthopedic test, and mind you to say, you have to, when you're on a sideline and you're dealing with collision sports, you have to know the difference between when it's an emergency situation and it's a chiropractic situation. But that's again a discussion for a different time. That's something that we learn as a graduate chiropractor. You should be well versed in that, anyways. There shouldn't be any problems differentiating when someone needs clearly medical care versus chiropractic care. But the overwhelming amount of athletes out there are going to need the actual chiropractic care. And it's going to be for functional issues, and it's going to be to enhance their athletic performance. And if you can get yourself out of the injury game and you can put yourself more into the functional or performance side of things, it's just huge. Yeah.
With that too, and I think another thing that you're doing, which is so crucial, if it was my kid or myself, is time. The longer that upper cervical is subluxated, the longer you have time to learn how to be wrong and be bad and develop things, and the faster you can assess the situation and make a correction, the faster the healing starts. And especially when we talk about the brain, how important is that?
Oh my goodness. I mean, if there wasn't a truer statement, that was it right there. Because, at the moment of the impact, if you can assess someone and gently restore their biomechanics and neurological function, oh my goodness, that's huge. If it's a 2 or 3 week delay until you see them, it's just absolutely sets up time for making the scar tissue develop and making it much more difficult. So that's an amazing point, getting adjusted right afterwards. And right up front, people need to know that, because they'll shy away of, if someone's been traumatized, a lot of times they're thinking, no, no, don't touch me, I've been hurt. But if it's a gentle, precise, precision-based procedure, it's really, really helpful. And that's the push that we're going to do, through the sports councils. We're going to try and get this technique and other techniques that each one of us have to offer, and we're going to try and standardize them within the sports community. And you're going to be able to get that certification right through the ICA, which is so very exciting.
I just love the fact that you're going to walk up and you're going to say, "This is our standard procedure. We already know what we're doing." And when you portray that confidence, the trainer, the athlete, and the parent already knows, "Oh, well, this must be exactly what we're doing." Even if we're the small minority of people actually doing it, the player gets that benefit. It's just that learning that confidence and knowing that's what you're supposed to do. And I'm very excited for the ICA certification coming out just on topics like this, just to give that chiropractor that certainty to know what they're doing.
Absolutely, absolutely. And as a chiropractor, let's say you're in a situation where you're dealing with a team, as you're well aware of. You're going to have a trainer, a physical therapist, you might have a medical doctor out there. But the deal is this: is as a chiropractor, what you want to do is be separate, unique, and distinct. Offer a service that no one else does. Certainly, we don't want to duplicate physical therapy, which is really great stuff, but that's not our line of work. We don't do massage, and if we stick to really what is relevant and stay in our lane, oh my goodness, it's just such a good work environment when you include everybody as a team, but yet not step on anybody else's professional boundaries there.
It's been my knowledge and my experience is that they don't want to work with concussion patients. They just want you to sit and wait and keep retesting you. And I'm like, hey, when it's a subconcussion, concussion, or whatever it might be, you guys
Well,
go ahead and do all the tests you want. Let me do the care.
exactly, exactly. Concussion ends up being mostly an opinion piece, and sure, if there's a big hit, that's part of it. If there's some neurological tests that you can do, but again, if you take a person who has a full blown concussion and you can gently adjust their upper cervical area, they are going to recover very, very, very quickly than if they don't. And that's very, very, very important. But it's good to have that kind of discussion with the trainer, with the physical therapist prior to going in there, where you're all working as a team. But I've never heard it was a great statement: the sooner the better, sooner the better, and the more precise the better. Yeah.
And I think that's what a lot of the newer or chiropractors want. They want to know what to do on the sideline. I know I have got 4 daughters, and I was told to always carry a medical emergency bag because a lot of times I'll be the only healthcare provider of any type at their
Yeah.
sporting events. And a lot of times you see somebody get hurt and you run over like, hey, now what am I supposed to do? So having this protocol written up, taught to the ICA, Sports and Science Fitness Council, and you have that certainty, you have that certificate, and you'll know exactly what to do on the sideline. And I think that's going to be huge. So I'm glad you got this together for us. And I'm glad you're going to share it with our council and with our future students.
Absolutely, it's going to be my pleasure, and I'm hoping to really set a standard for all of us. And it takes teamwork to make the dream work.
I always ask everyone final words or any final thoughts, something I didn't talk about or cover that you wanted to bring up.
Well, my final thoughts are this: things are changing, and in the field of chiropractic and the healthcare field. And if I could say one thing, and appeal to all of our chiropractors, is at the heart of chiropractic is the chiropractic adjustment. If you do your pre-test and your post-test, sorry, tripping over my tongue here. If you can do your pre and post-test and you can deliver a good quality chiropractic adjustment, it is second to none as far as healthcare for our athletes and for our patients. And I just pray and hope that in the future that we gravitate back towards specific chiropractic care and its unique philosophy. And that would be my hope for everybody.
Then I'll throw on real quick that to be me to be your team chiropractor, the one thing I require, whether it's middle school, whether it's high school, whether it's professional, whether it's NHL hockey, everybody has to have an x-ray before the season starts because we want to have that baseline to what to look
Mhm.
at in case there is an injury. So then we
Yeah.
can do a post x-ray down the road and be able to get you back in. Don't be afraid to take those preseason x-rays. For us, the way we sell it to the owners is after the season's over, the player might sue you for lower back issues. And if you had a pre x ray to show their back wasn't perfect, you're going to save the owners a lot of money. Players come and go, but owners stay. So make the owners happy. So get those x rays.
That's a great idea. It's a great idea. And that's a lost art in chiropractic too, is the lack of taking x-rays. But it's very, very, very important. That's a great point.
All right, everybody. So if you want to learn this protocol, if you want to learn more of the stuff we're talking about in the certificate that we've been talking about, contact the chiropractic.org. That's the ICA's main webpage, the main website. And we're taking this show on the road, and we're going to be coming to your state associations and your groups. And we're going to put together a 4 to 5 hour presentation with the two of us and the rest of our board. And we're going to teach you the skills, the tricks that you need to be a chiropractor for an athletic team. And this is every level of athlete. This is going to be for the Super Bowl champions. This is going to be for the 8-year-old kids that play t-ball or the the soccer swarms. We had the one soccer ball and all the kids just followed around. We're going to teach at all levels, the adult league, hockey leagues, whatever it is. So if you want to get more involved in the sports and you want to have that confidence when you walk into that room, that's what we're going to be teaching. And we're going to give you a certificate, CE hours and everything. So reach out to us, follow us more. If you like this podcast, please share this podcast, subscribe, like us, share us, and we're going to keep coming at you with the latest things in chiropractic, sports, and fitness. Thanks for tuning in. Dr. Jackson, thanks for joining us.
Thank you so much.
All right. Thanks, everybody. We'll talk to you next time.